Why do antibiotics only kill UTI bacteria? Imagine a tiny army of bacteria invading the bladder, causing discomfort and infection. Antibiotics are like specialized soldiers trained to target these invaders. But how do they know which ones to attack? The answer lies in their design to target specific features found only in bacteria. Most urinary tract infection bacteria are mainly a type called Escherichia coli, or E. coli. These bacteria have unique structures that antibiotics can recognize and attack. For example, many antibiotics work by disrupting the bacteria's cell wall. Human cells do not have cell walls, so these antibiotics can destroy bacteria without harming human bladder cells. This is what makes antibiotics so effective and safe for treating infections. Another way antibiotics target bacteria is by interfering with their ability to produce essential proteins. Bacteria need to make proteins to grow and multiply. Certain antibiotics block the bacterial machinery responsible for protein synthesis. Since human cells use different processes to make proteins, these antibiotics do not affect our cells directly. Bacteria also use special structures called pili to stick to the lining of the bladder and form protective communities called biofilms. Some antibiotics or new treatments can prevent pili from working properly, stopping bacteria from attaching and spreading. This helps the immune system clear the infection more easily. The environment inside the bladder itself also helps fight bacteria naturally. The bladder's acidity, high urea levels, and antimicrobial peptides produced by bladder cells create a hostile setting for bacteria. Antibiotics work alongside these natural defenses to eliminate the bacteria that manage to survive. Because human cells lack these bacterial-specific features, antibiotics do not harm our bladder cells. This selective targeting is the key reason antibiotics can kill bacteria causing urinary tract infections without damaging the tissues of the bladder. However, it's important to remember that antibiotics can also affect the good bacteria in our gut and vagina. This can sometimes lead to imbalances or overgrowth of resistant bacteria. Overuse or misuse of antibiotics can cause bacteria to develop resistance, making future infections harder to treat. That's why healthcare providers carefully choose and prescribe antibiotics, ensuring they are used appropriately. In the context of bladder health, using antibiotics properly helps clear infections, reduce inflammation, and prevent complications like damage to the bladder or even more serious issues. But always consult a healthcare professional for diagnosis and treatment. They can determine the best approach based on your specific situation. To sum up, antibiotics only kill UTI bacteria because they are designed to target bacterial structures and processes that our human cells simply do not have. This precise targeting allows us to treat infections effectively while keeping our own cells safe. It's a remarkable example of how science has developed medicines that work with our bodies to fight off infection without causing harm. Remember, always seek medical advice if you suspect a urinary tract infection, and use antibiotics responsibly to protect your bladder and overall health.